The battle over ballot questions will be decided on Election Day.
22 News I-Team reporter Tamara Sakarzik examined one of the state's most controversial questions so voters can know what they're voting for or against.
That's right. We're talking about question 1, which asks voters whether there should be mandatory nurse-to-patient ratios at Massachusetts hospitals. This initiative has generated a lot of buzz and a lot of confusion among voters. Nurses say yes on question 1.
Backlog, patients being stuck in the ED, not being able to get into patient rooms, will improve with hiring more staff.
Nurses say no on question 1.
We will have to restrict access to care. We'll have to close beds.
For months, we've been bombarded by commercials, lawn signs, and rallies over question 1. If passed, it would create nurse-to-patient ratios varying from 1 patient per nurse to 5 patients per nurse, depending on the hospital unit. Both sides have been actively trying to sway voters. We've been hearing a lot of nurses say yes to question 1 and then nurses say no to question 1, and the language kind of looks the same here. So how do you expect voters to agree on this when nurses can't agree on this?
The nurses who are saying yes on 1, largely, are bedside nurses. The nurses who are saying no on 1, largely, are administration nurses.
Suzanne Love is a registered nurse at Bay State Franklin Medical Center and a member of the Massachusetts Nurses Association, the union behind the ballot initiative. She told the I-Team their goal is to improve patient safety.
Infection rates go up, mortality rates go up, patient dissatisfaction goes up, patient readmission for the same problem within 30 days goes up when the nurse has too many patients.
Molly Gray is also a nurse, and she disagrees.
There is no indication that a numeric number of nurses per a numeric number of patients gets to better quality outcomes.
The I-Team examined studies from California, the only state that has mandated nurse-to-patient ratios. Those studies indicate that while patient outcomes improved in certain scenarios, others showed no change and in some cases even worsened. The California Department of Public Health told the I-Team they've never done an analysis that proves their staffing ratios lowered mortality rates. Money is another major factor surrounding this ballot question. Hospitals like Bay State have said that the high cost to implement it would force smaller community hospitals to close and lead to longer wait times. But the Nurses Association has said they're just using scare tactics. If question 1 passes, hospitals would have to hire up to 3,100 nurses to meet the mandate. The M&A estimates the initiative would cost between $35 million to $47 million, but the Health Policy Commission says it'll cost as much as $949 million. Question 1 opponents argue the cost would force smaller hospitals to close and insurance premiums to rise.
Can they increase healthcare costs for consumers?
I don't think that they can. Healthcare costs are healthcare costs. Insurance companies, Medicare, Medicaid, have a very strong voice in how much healthcare is reimbursed.
So you think the insurance companies would end up raising the cost for consumers?
And that money does need to come from somewhere, so that is a serious concern.
The I-Team could find no evidence that hospitals closed in California as a result of nurse-to-patient ratios. As for health insurance premiums, the average monthly premium in California is $525 compared to $554 in Massachusetts. California's law was phased in over a 5-year period, while the Massachusetts law would go into effect on January 1st if question 1 passes. Hospitals would be fined $25,000 for each violation, but it's still unclear whether they would need to hire the additional nurses by January 1st. I'm Tamara Sakarzik working for you with the 22 News I-Team.